G'day! So, Botox, is it the new wonder drug for erectile dysfunction, or will it just make your floppy penis look younger? In the next few minutes, I'm going to give you all you need to know about Botox and whether it is worth spending your hard-earned money on this treatment for erectile problems. My name is Dr. Simon Snook, and this is the Kiwi Sex Doctor, where I give you tips, tricks, and hacks for a better sex life. So let's start with how it's supposed to work. Well, most people have heard about Botox and its use specifically in appearance medicine, where it's injected often into the face to get rid of wrinkles and make someone look younger. It's actually used in a lot of other parts of medicine. It can be used in the bladder to help people with overactive bladder syndrome. It can be used for people with chronic migraines, and even used injected into the armpits to help people with excessive sweating. In fact, pretty much every branch of medicine is playing with Botox to see what it might be able to be used for. It comes from, it's actually a toxin produced by a bacteria that if in a disease form you were to ingest that bacteria, can cause your entire muscles to become paralyzed and can be fatal. But in a controlled amount injected into a certain part of the body, it can relax muscles and have positive effects. So how can relaxing muscles help with erectile dysfunction? Well, you get an erection from blood flowing into the penis faster than it can flow out. And one of the things controlling the blood flow into the penis are tiny little muscles, they're called smooth muscles, around the blood vessels. And the tighter these are constricted, obviously the less quickly blood can flow in. So the theory being, if you can paralyze these muscles with Botox, they will then relax, allowing more blood flow into the penis. So let's get to the big question. Does it actually work? Well, there have been some medical studies done. These are double-blinded, randomized controlled trials. And these are really the gold standard for medical trials, where neither the person performing the experiment or the person receiving the experiment know whether they're getting a drug or a placebo. And then we can see whether it is a real effect or a placebo effect that's making a difference. In these trials, albeit there's only a few and they've been quite small, it has certainly shown that Botox works for erectile dysfunction. But these trials have only been done in people who have already had erectile dysfunction and have failed in their use of medicines like Viagra or Cialis or even trimix injections. So the trials have been done in people with relatively severe erectile dysfunction and looking at rescuing them from that failure of those medicines, rather than as a first-line treatment for someone with erectile dysfunction who's had no other treatment at that stage. And what's seen in those studies is that a single injection of Botox will cure about half of the people of their erectile dysfunction. And if they have repeated injections, by the time you have 3 repeated injections of Botox, about 90% of people have gone from not being able to get an erection whilst using something like Viagra to being able to get an erection. So that's really quite a significant improvement. And the next question, of course, is how long is it going to last? Well, it depends a little bit on how much Botox you use. If you use around about 50 units of Botox, the effect will last about 3 months. If you double that up to about 100 units of Botox, well, that will last about 6 months. So how long it lasts certainly does depend on the dose. So now your interest is piqued and you think, well, this might work for me, but what does it actually entail to get this? Well, it's not too bad. It does need to be injected into the penis, which is not necessarily something that everyone's really excited about. However, it is a very small needle and the injection only takes a minute or 2 to do. So it is not a major procedure to go through, and you can walk straight out and you can be using your penis again straight away. So there's no concerns about downtime after the procedure, very little chance of bruising or anything like that. There is a small risk that you can get some scarring around where the injection has gone in and get some scar tissue in the side of the penis, but that risk is there even if you're using things like trimix injections as well. So it's a known risk, but again, not something that I would think would put many people off. So what about the cost? Well, of course you have to pay the doctor for their time and all those things, but the most expensive part of having Botox is the Botox itself. Botox is ridiculously expensive. In the US, the cost per single unit of Botox is around about $10. Now, if you think back, we're talking about the lower treatment dose of Botox for erectile dysfunction being 50 units. So you've got $500 worth of Botox going in for a single injection, up to maybe $1,000 if you have the longer lasting version of that injection. And then obviously you put on top of that the other costs that go with it. So this is not a cheap process. Having said that, if you actually break that down into the cost per day to have erectile function back again, you're talking about around about $6 a day, which is certainly equivalent or even cheaper than things like Viagra or Cialis, depending if you're buying the trade name version or the generic version. So there is some equivalence there. And of course, one of the benefits of having things like Botox is it's a once only treatment, and then in theory you can use it without having to think about it, rather than taking a pill prior to sexual intercourse. But as I said, the data doesn't really support its use on its own. It generally supports its use alongside things like Viagra in those people who can't get an erection with Viagra alone. Now, that's not to say it doesn't work on its own in people as a first-line treatment, but there just aren't the studies there. So, of course, in the cost, you have to decide whether you're someone that's going to be using it in combination with another expensive treatment or on your own. If you use it on your own, there's no problem with that, but you just don't have the data to back up that it will absolutely work in your case. So my conclusion is that this is certainly a very exciting and promising mid-term treatment for erectile dysfunction. It's not a cure, but it's a longer-term treatment than taking a pill every day or injecting yourself every time you want to have sex. And that in itself is a really good thing. But we are still in the early days and it is very expensive. There are few side effects from it. So if you have the money and you're interested in it, I don't see a problem with going ahead with it. But I would certainly consider whether that is the best way to spend your money. Now, I hope this video has been helpful for you. If it has, please do give me a like and subscribe to this channel. Do also leave me some comments. It's always useful to hear back from you, and if you want to suggest other topics that I go through on this channel, I'm really happy to address those. Other than that, thanks for your time. Take care.